Any other medicine which comes close? How do you differentiate?
If the Staphylococcus habits suppressed from mainly anger of suppression, and also in the Staphylococcus have a sexual sphere involvement.
Exactly. Very. Staphylococcus is mainly suppressed anger. You don't have these kind of so much varied suppressions in Staphylococcus. And Staphylococcus, you won't find any anxiety with Staphylococcus. It's like a passive suppression. Oh, let it be, let it be, let it be, let it be. But here, every time they hear a knock, oh, it's my next door uncle. Every time the boss rings a bell, boss is going to shout at me. So that anxiety is constantly there, living in that anxiety every day. They have this boss for the last 10 years, but whenever the boss asks, yeah, it's calling you, oh, boss is going to shout at me. You're with me? So that is important for carcinosin. Really, really useful medicine. You know, it will take time. Obviously, not with one dose you can help with this medicine. It take time, but start with 200C and then you can help with this medicine. Again, not in tincture, cancer tissue.
And then the LMs. People with
Your favorite medicine is carcinosin.
It is. It's electric. 2 times a day?
No, this is just one dose. Whenever we give these medicines, like in potency, 200C, it's like globules. So 1 or 2 globules in a bottle of water, and patient sips that for 2-3 days. Whenever we're talking of tinctures, that is in 10 drops, right? Tinctures in 10 drops, but this is talking in potency, that is 200C. And there is generally 1 or 2 globules in bottle of water and sip it for 2-3 days. Just one dose and see how the patient responds after that. You don't have to repeat too much. Just one dose and see how the patient responds.
If it's about work, it's not about family or something like that. It's something like when we hear the ring and something happened something bad, and call something like this, and pick up the phone. Every time that I pick up the phone and something bad happened, we can use Carcinosinum.
Every time they pick up the phone?
Yeah, like when have something bad problem.
Like always,
yes.
They think that something bad is going to happen.
We call this person, just only this person will pick up the phone to solve the problems. So for a long time, for a year, 2 years.
And they're anxious about it?
Yeah, when they hear this ringtone, something like this,
okay,
they will, oh, what happened again, something like this.
Yeah.
We can use this.
Yeah, definitely.
But
yeah.
It's not about family.
But it's like an anticipation. You understand? Anticipating something.
All right.
So in that way, carcinosin fits the picture as well. Anticipation. If you think of anticipation as a cause, like I'm anticipating is thinking something is going to happen.
Mm-hmm.
So that's a cause, and it's a prolonged history, and there carcinosin comes in as well. Could be any sphere. Okay. All right, with carcinosin. Very, very good medicine. I'll skip phosphorus here. Phosphorus is not anxious. We have done pulsatilla, if you recall earlier on. Pulsatilla, we done that. Last one, sulfur. Just coming back to carcinosin. Have a look at this picture. Romantic candlelight dinner, carcinosin. Very romantic, very soft. This is, I'm just doing carcinosin, we'll go to sulfur in a moment. You see soft-hearted, romantic people. Sympathetic, sentimental.
Music rhythm center stop is...
Pardon?
Music rhythm
Yeah, the
center
rhythm.
stop is amyl.
Yeah. Music makes them better, rhythm makes them better. Rhythmic thing makes them better. Music, love. They love music. Music lover. You know, all the, it's like an attractive artistic personality. That kind of a personality. If you look at this triangle, very important. Family oriented. Very important word for this medicine, carcinosin. Very family oriented. dutiful, passionate, very, very, very dutiful, always want to keep up the family ties, family duties. But sometimes they can become rebellious as well. You see, I mentioned there, rebellious. You see, it's got such a variety of spectrum of action of this medicine. You can cover anxiety, you can cover depression, you can cover fear psychosis, you can cover bipolar, so many areas of action. Even schizophrenia, you can help with carcinosin. That's why I always share with you, telling you, keep it this for the last weapon. Try something at first. If it fails, keep this as your last resort. Right? Really helps. And homeopathically, always ask the patient about their life story. Say they're 45, 50. Ask them about the life story. And they will tell you, oh, my life, I've had so many disappointments, so much anxiety, so much. I always ask the patient 0 to 10, 10 to 20, 20 to 30. Anything major emotional, anything major physical. Just quickly. And they will tell you, oh, 20 to 30, I had this disappointment. 30 to 40, I had this. 40 to 50, I had this. Yeah.
He says we should think about this one for the last weapon to use.
Now, if you have a picture, obviously you can prescribe in the beginning as well. That's not
what was the first weapon we should think about?
Like if you have a lot of anxiety, you can think of arsenic as a starting thing, right? Because of the anxiety of the anticipation, arsenic could be there as well. If you have a lot of depression, atmure could come up. But you understand, there's not much symptoms because everything is inside. They're always keeping it inside. Only occasionally you'll get that violent outbursts. So its initial stages is very difficult to understand carcinosin. But what you'll get the history. And from the history you can prescribe this medicine. That there's been a history of prolonged anticipation, prolonged apprehension, prolonged fright. Because you understand there is suppression, so there's not much causes, not much reaction. So there's everything is inside. She'll tell you, I always feared this, I always feared that. But I always try to maintain the family dynamics. That's what she'll say.
I wonder when you start giving them the carcinosin.
What will be the reaction?
Okay. Yeah. Give a big.
The violent outbursts will be much better. A. The violent outburst. That's a good question. What will be the reaction? Right? The violent outburst will be much better. A. B. After giving carcinosin, they will be able to speak for themselves. They will be able to speak for themselves. They will not tolerate that kind of rude behavior. They will be able to speak for themselves in that way.
That's just a problem after prescribed carcinosin.
Sometimes,
yeah. There's a problem, they divorce.
They divorced after giving carcinosin.
Yes, after prescribed carcinosin. Because they say that they never think about themselves.
About themselves
first. Yeah. After prescribed carcinosin, they always lie to me every day. They start thinking about themselves.
That's good in one way, isn't it?
Yeah, then integrity of themselves.
So to reaction, right? You say that to reaction.
The violent outbursts will be better. They will be able to speak for themselves. Speak for themselves. Whatever they're keeping it inside, they're able to speak it out. Right? And with all this kind of suppression, you'll get a lot of physical symptoms. Patient is diabetic, patient has hypertension, patient has a lot of others. Physically, it's like a psychosomatic disease. Causes in emotional plane, affects them physically. So a lot of physical ailments as well. That can improve as well with carcinosin. Right? The blood pressure I found comes quite to normalcy because with a lot of suppression, there's a lot of anxiety and hypertension precipitates as a consequence of that. That can be helped with carcinosin as well. That can be.
At first, beginning, most patients ask me back, how come this medicine?
Most patients ask you?
Yes.
What?
How come this medicine? This came from carcinoma cell.
Yeah.
Maybe
So
get them more anxious.
More anxious. You don't have to tell them you are giving them this.
Give him arsenic instead.
Just write CAR, CAR.
See,
CAR 200. Yeah. I never write arsenic on my prescription, just ARS. They'll get more anxious. Arsenic is himself anxious. You write down the prescription, you're giving him arsenic, they will die before going home. Right? Just write ars and give them a prescription. Don't need to write the medicine. Just write something else. It's difficult to explain, to be very frank with you. It's very difficult to tell the patient. Yeah, it's very difficult.
What kind of cancer that
This is prepared from breast. Breast. But obviously you are prescribing in potency 200C. There is no material quantity in that. You understand that?
Best thing is patient should have know the name of the remedy.
I agree.
It's the homeopathy.
No, like arsenic, you should never write arsenic.
Just only say.
I think it is hardly differentiate from bad.
Staphylococcus aureus is just, I shared with you, more for suppressed anger. Anger is suppressed. Here you see fear and fright that's suppressed, parental domination, grief, unhappiness that is suppressed. And in Staphylococcus aureus, they let go. They don't hold it inside. It's okay. Now I move with it. I live my life. Here I shared with you, even a knock, they can understand. They will think that. They will relate to that situation. So it's always in the head. It's always going on in the head.
So it's
That is for carcinosis.
anxiety and anticipation together.
And together. And in Staphylococcus aureus, you will not find that rebellious and soft together. They're always soft. You won't find rebellious in case of Staphylococcus aureus.
Oh, yes,
Always
that's
soft.
not rebellious.
Not
Not
rebellious.
rebellious. If rebellious, you think about CPR.
Also, if you have the changeability, carcinosin can come up as well, right? Remember, the cause is different. Cause is suppressed anger only for staph. Only. The reaction is also different. Why different? Carcinosin thinks about it, what has happened. Staph doesn't think about it, right? Carcinosin will have the changeability, the variation. Staph doesn't have the variation. Very good, useful medicine. Another picture. Yeah, if you look at this is another good example. You see on one side 3D, destructive, disobedient, disapproves authority and control. So they can be destructive, always trying to maintain the family. Suddenly one day hits the sun and is admitted to the hospital. That kind of destructive. Sudden outburst of anger. That can be disobedient. You see another 3S, soft, sympathetic, sensitive. So that kind of bipolar-like behavior you can find with carcinosin. Why? You have to think there has been so much in the history of the patient. So much causes in the background. Doormat carcinosin. Remember that, please. Remember the comparison with doormat and the cancer cell. Like the cancer tries to stay within a limited organ initially, but unfortunately as time progresses, metastasizes. Similarly a carcinosin. Initially will try to hold it inside. So you think she has got suppression from age 20, age 15. She has had parental domination. She keeps it inside, You'll find at the age 30, 35, she's having suddenly sometimes outbursts of anger. Age 40, she's very destructive. She's very angry. That kind of behavior you'll find with carcinosin. As time progresses, the pathology progresses. You with me? You see a picture, unhappy childhood. The child saw the father is beating up the mother. This uncle is knocking at the door and she's taking a bath. Sexual abuse. So see, so many histories in the past which has affected her. Right? You see, get that so common. Person who has sexually abused him. Whenever he meets a new person, she feels that, is he going to sexually abuse me? That we'll find in carcinosin. Staphylococcus aureus doesn't have that. Staphylococcus aureus has okay, I had this in the past, but Whenever meet a new person, they won't say that if he's going to sexually abuse me. That's not in staph aureus. Carcinosin has that. Whenever they meet a new person, they'll think, isn't he going to sexually? They had a same-sex encounter sometime, like a sexual abuse from the same sex. Whenever they meet someone who is trying to be over-friendly, they will think, isn't he going to do that same thing with me? So that kind plays in the background for carcinosin. You're with me? I hope I've made this medicine clear with you. Do use this. No discussion of psychiatry is complete without carcinosin, because it covers all spectrums of psychiatry. Depression, anxiety, bipolar, everything. Fear and fright, everything. Okay? We take a break.